I want to thank everybody for joining us today for our fourth quarter, believe it or not, 2020 preparation. So let's go through the agenda. Again, I'm Joyce Cardwell. I'm the Vice President of Sales Support. With me today, I have Eric Bain, Director of Sales, who's going to talk about all the new hot products. Melissa Coles, which is a broker sales representative. She's going to give us a great news about technology updates. Sharon Norfleet, I think everybody knows Sharon, our sales support manager. She's going to talk about Consumer Direct and all the great updates we have with that product. And she's going to talk about the small group fully insured processes for 2020's fourth quarter. Small group quoting, you're going to get Eric back again because he's got some updates on our quoting system. And then Stacy Helbig, Little But Mighty, our implementation manager, she's going to talk about our large group fully insured processes. And then we'll go into our self-funded process with Dave Cardwell Jr., who's our underwriting manager. And then I'll come back and actually talk about our next steps. So one of the reasons that we have decided to have these fourth quarter preps is so that we can allow us to help you to be able to have a successful fourth quarter. So we're going to ask that you collaborate with your partners, meaning your broker reps. We're going to talk about the day in the life of fourth quarter because it hasn't changed in the 35 years or the 40 years that Dave Sr. has been in this business. You know, we constantly talk about our bottlenecks and delays. We're going to talk about how to address that to make it easier and more successful to streamline it. Communication and concerns, that's a key. Communicate to us. Work closely with us. Work closely with your broker reps so that this process is good for you in fourth quarter. Discussions today and identifying solutions, understanding that bottlenecks are going to happen. It has, like I said, it hasn't changed in many, many years, and I don't think it's going to change this year, but what we're going to do is try to make it as easy as possible for you. Understanding common pitfalls and delays. Quicker communication turnaround with missing data and forms. So Sharon's going to talk a lot about that today. And GBS is really committed to our brokers and their clients. So that's why we're going to do our best to make sure that we work closely with you for a successful fourth quarter. At this point, I'm going to actually turn it over to Eric Bain and let him talk to you about all the hot products.
Thanks, everybody, for joining us this morning. I won't belabor this too long, but there is some exciting news from all of our major carrier partners out there through fourth quarter. And we just wanted to highlight some of these. You've probably seen them on a collective broker flashes from us and even the carriers over the past few weeks. But let's open up to the next slide. Let's talk about United Healthcare real quick. United Healthcare is giving premium credits back to groups when selling a bundle of products. So if you're selling 3 lines to a client that totals a certain amount of premium, they'll provide a credit back. That's for effective dates through July 1st all the way through the end of January, so January 1 effective dates. So if you pick up any of those United Healthcare ancillary lines and you bundle those together for a collective premium amount, they're providing credits back to our clients, which is awesome this day and age. So we're excited to share that from them. Aetna, AFA, again, a lot of this is out there in news, but I can't stress it enough, and we're going to highlight this a little bit more on some of our quoting tools. But Aetna's AFA funding product is available for groups down to 2 lives now, which was announced earlier this year, which is exciting that really kind of rounds out its ability to service the small group market space. It's also available for large groups starting in August this year, over 100 lives. So that's exciting. Just a reminder, their self-funded platform returns 50% of the claims surplus, and groups that are getting that surplus, the average surplus amount is over $8,000. What an awesome way to service the small group market space. One other quick note on Aetna is that it is available on all of our quoting platforms for September 1st effective dates. So we'll touch on that when we get into the quoting stuff a little bit more, but I think it's worth noting. Our friends at Kaiser Permanente are putting together a small group bonus. Small group bonus is available for brokers. So when they're writing small groups with Kaiser, they deliver that in the amount of a gift card, which is exciting. But if we're writing small groups, September 1st effective dates through January 1, they are giving out bonus based on the number of enrolled subscribers on the group. So for small groups, as small as 6 enrolled, there's a $500 gift card available, which would, sure would be nice. But then those bigger small groups, 26 more enrolled, there's a $5,000 gift card bonus. So that would be very nice. And if you need help spending it, call me. My number's on the last slide. Okay. So also from Kaiser, They also have an incentive program for their large group platform. So if we're selling large groups, we can earn up to an extra $2,750 per group sold. So that bottom box is probably the most important. Who's eligible? New to mid-market large groups with an effective date after September 1st and before September next year, with a minimum of 51 plus enrolled employees. So awesome programs from them. You know, they gave us an update last week. They're still on track for their Timonium opening next year with their big Timonium center. So excited to see how they're really expanding into our market space and pushing north on this 95 corridor. So CareFirst. Now, Sharon's going to elaborate a little bit more on this, but we're really excited to announce starting this fall for January 1st election period, Medicare Advantage plans from CareFirst. So first and foremost, broker selling need to go to this link here for America's health insurance plans and get themselves a certification course. And Sharon's going to elaborate in a little bit more detail, but exciting that we have additional resources from CareFirst in our market. And last but not least, from our friends at Cigna, it's not a specific incentive, but highlights on their program. One thing that we've identified, and Stacy and Joyce can speak to this a little bit as well, is Cigna not only serves the fully insured, but the self-funded market space, and has delivered very competitive rate offerings and bundling programs when we're putting together plans in the mid-market space, especially, so that 51 to 99 market and above. They've been a huge player and a tremendous asset for lots of our brokers and clients, and it'd be remiss if I didn't mention them. So that's our hot products update for now. Without further ado, I'm going to hand it over to my colleague, Melissa Coles, to talk about some technology stuff.
Good morning, everyone. Thank you so much for joining us today. I get the opportunity to talk about our exciting new technology updates that we have. We're going to start with Ease. So we've partnered with Ease earlier this year to do an online enrollment system that's easy to use, user-friendly for the employees as well as the employer, and also has a lot more functionality as far as reporting and flexibility. So you can do multiple waiting periods for products and class types, as well as multiple different payroll deductions. So one plan could have a payroll deduction and another plan could have a separate payroll deduction, and the system knows how to do that and has the calculations and formulas for that. The simple setup, we have a form that you would just need to complete with your client, and then we would do a walkthrough with you and the client to make sure everything is okay, and then we will release it to the employees. There's also a library of multiple marketing videos and trainings so that if an employer gets stuck on how to add a new hire or terminate someone, they can go to the support feature and find that information out. There's also broker and client access, like I said. The broker can also go in and check out all of their groups and make sure things are running smoothly. It can be used for open enrollment as well as year-round enrollment. And even more exciting news is we are doing demos for our brokers in September. So look out for those invitations for September 23rd or September 24th, whichever one you are able to attend. Our partners at Ease are going to put this demo on for you and show you all the exciting tools and the different features that Ease allows us to have. Okay. I'm also happy to announce that we've updated our HRA and FSA web portal that now includes a mobile app. So some of the features of this new technology, which is actually very exciting, is there's a mobile app. So right from the employee's phone, they can register, receive mobile alerts, which they could include account balance or your claim has been submitted or received. And they can also take a picture of their claim right from their phone and submit it for substantiation. They can also register their bank account to receive direct deposit right from their phone. And they can, so instead of receiving a paper check, they can get that reimbursement in a direct deposit. They also have access to the website 24/7. So if they don't want to use their mobile device, they can use the computer. And on the computer, they'll find trainings and tools and tips and tricks on how to use their HRA and FSA and what items can be used for both of those. And that's all that I have for technology, and we are really excited to show you guys all of these different tools. So I'm going to hand it over to Sharon Norfleet, who's going to talk about Consumer Direct.
Good morning, everyone. So glad that you could join us. So As Eric mentioned, what's new? Medicare Advantage. So this is exciting. CareFirst is actually launching new Medicare Advantage plans in Maryland for the annual enrollment period this year. So yay, as Eric said. Okay, so Group Benefit Services is actually partnering with GS National Insurance. This is a field marketing organization, and we're going to be able to offer brokers the ability to contract with CareFirst and sell their Medicare Advantage products. So we're excited about this. Should definitely help build your book of business. So the first thing, we do have a broker webinar and product training that will be held on September the 1st. That invitation has gone out to our brokers, so please be sure to make sure you register. Second, as Eric mentioned about the AHIP certification, so if you already have completed your AHIP certification for the 2021 year, then you can actually reach out to GS National if you're ready to start your contracting. You can request that information from GBS IMD at gbsio.net, and we'll send that information to you. In addition to that, if as a broker, you're interested in selling Medicare Advantage products for other carriers, so for instance, Kaiser or UHC or Johns Hopkins, you will also be able to complete that contracting with GS National. So we're definitely excited about this upcoming year and the additional products that we'll be able to offer to you. Now, on to Open Enrollment 2020, which is for January 1 effective dates. So just want to review this information. We have not received the final dates. Potentially, there may be extensions here, but this is the standard information. We know that ACA Open Enrollment in all markets start on November the 1st. In Maryland and Virginia, Open Enrollment typically ends on December the 15th. And then in Washington, D.C., the Open Enrollment ends on January the 31st of 2021. We want you to remember that all paper applications with a January 1st effective date, they're actually due to GBS by 3 p.m. on Tuesday, December the 15th. Now remember that all January 1 applications submitted after December 15th, so you missed your deadline and we received it after the 15th, are going to require the LOEP documentation, and that LOEP documentation, the limited open enrollment period documentation, is due to CareFirst by the 20th in order to receive a January 1st effective date. Now, as usual, you know that December effective dates are not going to be available in the iStore. So it is suspected that that will be the same that will happen this year. So for any December 1 effective dates, then paper applications must be submitted. So please make sure to get those submissions into gbsimd at gbsio.net. I know you all know that, so I'm not going to keep saying it. I know you're familiar with that email address. Make sure you get that into us for processing with the carrier, and then make sure that you send us the LOEP letters. And remember that all of the current LOEP deadlines still apply to the 12/1 submissions. And then we just want to remind you about terming existing CareFirst individual business. As a reminder, CareFirst will not retro-term a policy. So it's very important that you get your cancellation forms into CareFirst for individual policies prior to the term date that you're requesting. So if we have a client that's in a group or they're moving to a group January 1st and they need to term their individual policy, it must be to the carrier by December the 31st. This is very important. We're asking you to either submit your cancellation forms directly to us at the GBS IMD email address, or you can send that directly to CareFirst. Also remember that if your member is canceling a policy and they have auto draft, you should advise your member to go into their My Account immediately and stop their draft. Why is that important? Because CareFirst will not reimburse premiums. So if your cancellation form doesn't make it by the 31st and they had an auto draft, unfortunately, CareFirst will not return that premium. Small group fully insured. So we're just going to talk about some processes, reminders about the open enrollment periods for small group. So new business process. So we're just requesting that all submissions be sent directly to the new business email address. Please put in the subject line the group name, carrier, the effective date, and let us know that it's for open enrollment. We are suggesting that you also place on there a read receipt on your submission. That way you'll know when we actually received it. But in addition to that, you should receive from our team within 48 hours a notification from us letting you know that we did actually receive that documentation. Please, your submission, not documentation, your submission. Please remember that the FTE and the MSP forms for CareFirst groups, that is actually due with all new business submissions. I'm gonna throw that in there, renewals as well. But new business submissions require that FTE and the MSP form. Also, binder checks. They are also due with all submissions. So initially, you can send your new business submission in and we will take a copy of the binder. However, we need the actual binder check sent to GBS before we can install the group at the carrier. Just reminders, I know you all know all this stuff. With that, we did establish, and it's been a few years now, our communication process, because we want to make sure that you are aware of what's going on. So you should receive 2 to 3 emails at least during this process, letting you know. The first one is your thank you email. You should expect that, as I said before, within 48 hours of receipt of the case. In that email, we're going to advise you who's handling the submission. We are asking you to remember that if we receive a submission after 3 o'clock, it is counted as next business day. Then the second email that you should receive from us, we're going to either request missing information or additional information. And in this email, we're going to ask you to verify a couple of things. We started doing this last year because we want to make sure that we're installing the correct plans for the groups. So we're going to ask you to verify the plans that you sent to us. This is very important because if we send you a verification and you say, yes, Sharon, Tanya, Erica, those plans are correct, we're going to install those plans as you said. If we install the plans incorrectly, and you come back to us and say these are the incorrect plans, then we'll make the correction with the carrier with an effective January 1st effective date. However, if we sent the verification and you said, ladies, these plans are great, install, and then later you say, oops, then unfortunately we will have to install those plans. We will correct them, but we'll correct them with an effective date of February 1st. So it's very important to make sure that you read the plan verification and make sure that it's correct. Second, we're going to ask you to verify that if there are any existing employees. So this group you're submitting to us, are any of these employees enrolled in a current group? This is important because it can stop the installation process. So if this is, let's say they changed their group name and you didn't yet tell us to term that group, or somebody is in another group that's split off, we need to know because we cannot enroll them into the new plan until we term them from the old plan. And then last, the third email is going to be from us saying, submission was so lovely, we've done everything, it's on its way to account installation. And in that email, we're going to provide you with a group number, and then we're going to tell you who your account installation contact is so that they can let you know where they are in the process with your submission. For the special open enrollment period, just want to remind you, I know you know these things, but this is just a reminder. Rules do still apply. So first, we still need a complete case submission. So all of the regular documentation that you normally send us, we still need all of that documentation. Only participation rules for medical plans have been waived. So for dental and vision, participation rules still apply. Depending on the plans you selected, that's either 75% participation or 35% participation if they're voluntary plans. And then it varies a little bit depending on which carrier you're talking about. UHC and CareFirst do still require that you submit waivers even though there's no participation rule. We still need those waivers. And carriers will not accept letters stating that the employees are waiving. And the last most important one is that the group still needs to qualify as a group. So please remember that the owner plus one rules, they still apply. Kaiser is currently the only carrier that will accept owner-only enrollment in DC, in Maryland, DC, and Virginia. Now, I know my brokers that do this all the time are like, Sharon, that's not completely correct. You're absolutely correct. CareFirst, UHC, and Kaiser, all medical carriers will accept owner-only in Virginia, and that's because that's a state mandate. So that's the only exception to this particular rule. And then finally, the deadline. Open enrollment period. It's the craziest 30-day period. It's from November the 15th to December the 15th. Please remember that all submissions must be submitted to GBS by the close of business on Monday, December the 14th. We want to let you know that any submissions that we receive on Tuesday, December the 15th are not guaranteed to be submitted to the carrier prior to the deadline. Now, this is just a caveat to let you know. Now, I know that my brokers, you're sending us complete submissions. So for some of you all, this doesn't apply. But if we get a case on the 15th and it's missing information, we have to get back to you, and you don't actually get that information to us by close of business on the 15th. Unfortunately, we will not be able to submit it for the non-participation period. So please make sure that you send us a complete submission. If you have any questions about what a complete submission is, you can send that question to your delightful broker rep team, or you can send it directly to new business at GBS.io, and we will get you a checklist so that you know what that submission should include. And last, no late exceptions, unfortunately, are accepted by medical carriers during the open enrollment period. This is simply a reminder. We just want to remind you about the DC HealthLink process. It is definitely different from anything else. So the first thing we want to say is assign GBS as your default GA. That already is going to make your life better. So go into your DC HealthLink if you're DC certified and select GBS as your default GA. So what that does is anytime that you process a new group in the DC HealthLink, you're going to process it as normal. You don't have to, for each individual case, assign a GA because you've made GBS your default. Once you have completed your submission in the DC HealthLink, then GBS will be able to see that group. So as a reminder, the DC HealthLink does not require carrier documents to be uploaded. So it's not the same as a basic submission. What you actually will be doing is all of the information, group information, is actually manually entered into the portal. So once the group has been established in the DC HealthLink, then the new group is going to be processed by the carrier and you're going to get a carrier group number. You're familiar with this with CareFirst Business. It's going to be a 4-digit alphanumeric number, okay? What we're asking you to do is that once you get your alphanumeric group number, we're asking you to have the group complete a GBS application. We want you to send the application and the group number, as well as the group name. Send that to newbusiness@gbsio.net. And what will happen is we'll get that documentation. We'll be able to pull the group information from the carrier system. And so what does that mean? That once we've been assigned, then if you have any questions, you need enrollment, you need benefit changes process, now GBS has access to your group and we're able to assist you with that. Last, with the DC HealthLink, so let's say that that same group is doing dental and vision. However, they're doing the dental and vision and it's not on the DC HealthLink. Then that paperwork should be submitted directly to new business for the usual processing at the carrier. Now the dental and vision submission will require all the standard paperwork. So they're making you work a little hard. So you send that information to us. And last, just a reminder, with any DC groups, you're going to have 2 group numbers. So one for the medical and one for the dental and vision. So that's all I have. Next, I believe, is Eric Bain, the great Eric Bain.
Ooh.
All right.
Wow, I'll take the great Eric Bain. Is anybody else convinced that Sharon could have done those slides without the slides? If anybody know, yeah, if anybody know, she could have done it blindfolded. You know, Sharon, what are the rules? Go. You know, but we are redoing our quoting tool, and we are leveraging a product called Benefix, which we are integrating into our platforms as we speak. Benefix is a new small group quoting platform, and it gives us some really unique features. I know some of you might have already seen some of these outputs as we've been running through a pilot program for probably the past 90, 120 days. Well, let's jump to the next slide. I'm going to tell you about all the great things and when you can have it. We have a user-friendly and modern-looking interface. So as you can see, there's a nice big button there that says New Quote, which is superior to Health Connect, where you have to guess where to start. So that's nice. And then additionally from that, we have flexible Excel output that includes hyperlinks to carrier benefit summaries. We're also getting carrier SBC hyperlinks built into the platform. That way you have all that at your fingertips from the very beginning. It'll have prior plan year, or 2019 in this case, plans and rates preloaded. So it's easy to measure year-over-year analysis, looking at current versus renewal. Quote and compare multiple carriers at one time, including Aetna's AFA product, which is exciting for us to share. So it's nice to have that. You can save favorites and preferences. You can add your agency logo and color scheme. You are not restricted to Amwins Blue or GBS Purple. You can make it full-fledged Hot Topic red and black if you were so inclined. So that is up to you. There's payroll deduction census, so you can do measuring and analysis. New business forms library. So Sharon helped us put together all the appropriate carrier forms, so you can actually click download forms at the end of your process and grab the appropriate forms you need to set your case up. There's live chat support from the quoting tool. So in addition to us here at GBS, happy to train, support, and get everybody up and running on the new platform, but there's live support in there as well. And then last but not least, there's an adaptable multi-choice scenario building. So if you want to show different variations of plans and analysis, with populations broken up across multiple plan designs, you can do it to make your life easy. So coming soon. Let's talk about dates when we're going to roll that out. Our official broker training for that is about a month out. Again, we're still fine-tuning a little bit to make sure it is everything exactly the way you want it. So we're working on that. So the official launch is going to be September 29th at 9 a.m. We're going to push out invites this week and then have reminders. And of course, our broker rep team will call you and pester you to attend as well. Remind you, not pester, remind, to attend September 29th. So we'll roll out the quoting tool then. We're going to give out access that day. So if you're currently using Health Connect, our current quoting tool, or OranQ Enhanced, as it's also been branded, we'll be releasing access that day. Invite will be out today. And if you want to potentially look at some of the proposals and provide your feedback, we'd love to give you some proposals or even potentially early access. So reach out to your broker rep. We'd love to help out there. All right, small group quoting. Things are getting better, and I'm pumped about it. All right, next up is Stacy Helbig for large group updates, fully insured.
Thank you, Eric. Good morning, everybody. Happy Wednesday. It is a beautiful day out, and we're glad that you could join us. So as everybody kind of has alluded to, a lot of this information is just a reminder. So if we can go to the next slide. Request for quotes. So all 51 plus large group correspondence should be sent to the largegroup@gbsio.net email box. Please, as Sharon had mentioned, and I just want to kind of go over this a little bit, email sizes can be very large. So please limit the size of your documentation being sent over to make sure that it is received by our team. If there are multiple emails, please put part 1 of 2, part 2 of 2, etc., and also put a read receipt. I know sometimes when the emails are coming through secure, they're kind of hard because it doesn't give us general information about that group or who it's coming from. So communication is awesome. So please, follow those guidelines if you would. It will take up to 15 business days to get fully insured quotes, and that's once we have all of the information that the carrier will require. As we're kind of going into this fourth quarter, most of the carriers are, working remotely still as well. So this is going to be interesting for the fourth quarter. I believe, the carriers are going to do the absolute best and will be, good to go. But, just keep in mind, please give us time to get these over to the carriers and the carriers to turn it around as quickly as possible. So for the 51 plus, we'll need the group screeners, the census with dependent information, waivers, and Aetna does require the employee work zip codes, the renewal documents, summary benefits, claims data if it's available, and the FTE. So if you're quoting for a group that is a January 1, we need the FTE for 2020. If it is prior to, so if it's a November, December group, we'll still need it for the 2019. Aetna does require the billing and collection agreement, as in that document, what the percentage of broker commission, if you will, needs to be. Okay. CareFirst commissions and producer service fee, this is kind of a reminder, but CareFirst, with renewing clients with 26 to 50 enrolled, they are eligible for a 1% discount on all lines of coverage for signing and returning the renewal early. So for November, it will be due by September 15th, and you can see the dates below. CareFirst will need a request for a revised rate sheet with that 1% discount, and then we would send that to you for client signature, as well as the MSP, FTE, producer service fee agreement. The PSF is only needed if something has changed from last year. So if for some reason the producer service fee is being reduced, let's say from 5% to 4%, they will need a new agreement this year. CareFirst is also offering a bundling discount. So dental is 2% off and 5.5% for vision off the medical premium for the first year. This is offered on employer-sponsored dental only, new, and also if they have voluntary dental or vision that's moving to an employer-paid basis. Please note that if for some reason that dental and vision was dropped through the year, the medical rates, CareFirst has the right to adjust those. New groups. Aetna and UHC, and again, you probably are familiar with this, Aetna and United Healthcare requires that the group paperwork and the enrollment census be submitted prior to them starting setup. So we can't send them, a UHC, a group agreement, and expect them to kind of start with the process. So we will be looking to have all of the enrollment and information for a clean package to go over to the carriers. CareFirst and Cigna will begin implementation with the group paperwork, and the enrollment can follow. Installation times, carriers up to 2 weeks to set up their system. Again, with this kind of being uncharted times, being fourth quarter and working remote, please give as much time as possible. I know all the brokers are, doing the best they can with meeting with the clients virtually and getting all of that set up as quickly as possible. So just a reminder, GBS needs up to 2 weeks to process plans and enrollment in our system once it's been submitted to the carriers and the carriers have provided group numbers and such. Please allow up to 4 weeks for installation once all of the information has been submitted. Broker records, and this really goes across small group and large group. Brokers need to be appointed with the carrier prior to submission. That just makes life easier and will not delay the processing of that BOR. All BOR letters should be on company letterhead and meet carrier specifications. The name, address, telephone number, and group number, signature of an authorized person, and what is the renewal date. As a reminder, Aetna and UHC will only move to a TPA at renewal. Cigna is the same. So please keep that in mind. So if you're looking to move a group over to GBS for the upcoming months, please reach out to us. Let's have a conversation and kind of take a look at that client so that we are, doing things as streamlined and as clean as possible. Please verify that the group has been paid current prior to submission. There are carriers, most of the carriers, that will hold up the submission if they have an outstanding balance. And excuse me, if there's going to be any plan changes at the renewal, please let us know that as well so that we can work with you in getting the right plans and everything for submission. We also do need a GBS application. And if you could please complete that as much as possible. It is, there's a lot of information on those forms that we really do use. Renewals, CareFirst alternative plans. If it's a current group and you're looking for alternatives with CareFirst, please provide the name and the RX that you are looking for. CareFirst is going to ask for that information. Also, if the group is currently small group, so the 2 to 50, and their FTE pushes them into the new 51 plus market segment, the CareFirst is going to look for what plans are you looking for. They, especially during fourth quarter, will not kind of look at the small group compared to the large group and make an assumption. They're going to look for us to provide that information. Carriers will take about 2 weeks to set up their, again, the renewal plans and enrollment for processing. Documentation for Aetna, again, this is kind of just a review. We need the signed renewal page and the billing collection agreement. What is new this year is if they are making a plan change, Aetna requires a census with the plans mapped from their existing plans to the new plan. So again, if you have any questions, please reach out to us and we can discuss that further. CareFirst, if the group is moving to CareFirst at renewal, a binder check will be required, even though that account is with GBS. Make sure that it's signed with the TIN number, the MSP, FTE, and the producer service fee agreement, if applicable, as we discussed earlier. Cigna requires the signed renewal page, and UHC, the signed, they don't request a signed rate page, but we do for audit purposes. Like to have the client initial and date the plans that they are renewing with, as well as the billing and collection agreement. Okay, GBS, how are we to receive enrollment? It used to be long ago and far away that it was paper enrollment forms. Now with all of the technology, how are we getting that enrollment? So those are things that we will be discussing with you as we are talking through the renewal process. Just as a reminder, for groups that are using our online platform, please allow 3 to 4 weeks to kind of back into when you're looking to do the open enrollment meetings. when paper is submitted, because again, we need to submit it through the carrier and then set up our systems. And if a group is looking to set up online enrollment for renewals with our online dashboard, please we need to have that conversation now. Also, as Melissa had discussed earlier, we also do have the ease capability. So those again are conversations that we should be having kind of now as we are looking forward to going into the fourth quarter. Okay. And now I would like to introduce Dave Cardwell Jr. to talk about self-funded.
Self-funded. I'm going to talk a little bit about the large and small group markets. Okay, level funded. This is typically our small to medium-sized market groups, anywhere from 5 to 100 lives typically. So the level funded plans are for small to mid-sized employers that are currently fully insured. Mid-market is underwritten with detailed claims experience. The small group plan is when you are offering or using what we call PHQs, personal health questionnaires. It's a fully insured lookalike that's billed at maximum liability, and the employer owns 100% of the claims fund. This is unlike most of our competitors in the marketplace, so it's a key selling point there. We use multiple A-rated stop-loss carriers, and we also, our go-to network is the national Cigna PPO network. Traditional self-funded, this is, again, typically employers with 100 or more enrolled. Again, we use the Cigna National PPO, and we also have reference-based pricing available, which is a great way for employers to save approximately 20% on their claim spend. We offer numerous cost containment strategies. Sourcing specialty drugs has become very popular. That's an easy way for employers to save approximately 50% on their specialty drug costs. We offer bundled payments as well as patient advocacy programs. Just like with fully insured, we offer consolidated enrollment and billing with ancillary products on our self-funded lines. We have web-based technology with mobile apps and ID cards. And we are also partnered with the largest stop-loss wholesaler in the United States with over 30 carriers at their disposal. And that company is called Stealth. We offer FSA, HRA, and COBRA administration with all of our self-funded clients. Some of our key exclusive proprietary differentiators, that's a mouthful. Healthy Solutions, which is our population health management program that's been very popular over the past few years. That is an easy way for employers to save approximately 13% on their claim spend. We also offer a program called Provider Choice Rewards, where employees can pick low-cost, high-quality doctors. And not only does the employer save 5%, but the employees have the ability to get rewarded with a check for using those low-cost, high-quality doctors. Self-funded case submission. Just like with the fully insured, this is a busy time of year for our stop-loss partners. So we're asking that you submit paperwork for cases no later than the 6th of the month prior to the effective date. This is to ensure that members will have their ID cards and have them functional on the effective dates. Part of the reason being is that Cigna's PBM, it's not just Cigna's PBM, but most PBMs, especially this time of year, they take approximately 21 days to implement from the time of a complete submission, and complete submission being the key word there. We ask that you allow GBS 48 hours to process the submission and submit to the carrier. Another key pointer that we see is making sure that you are appointed and licensed with these carriers. And this includes if you're changing from one stop-loss carrier to another, we want to make sure you guys are appointed and that the change goes over smoothly. And when you are submitting your paperwork, make sure that we have the correct agent/agency information. We want to make sure however you want to get paid, we have that information on file so we can get you paid correctly. Healthy Advantage level funded. We try to stress this every year. Final rates are based on final enrollment. So if you submit a case and then you tell us you have a new application, we'll need to get that new application over to our underwriter to make sure that the risk score hasn't changed and the rates are still firm. If we get an application with some additional conditions, rates could be subject to change. AMQ, our web-based quoting, underwriting, and enrollment platform. paperless. It's the way of the future, and we're trying to embrace that. And we hope we have your support on that as well. It's obviously the most effective way to underwrite. You're not getting incomplete or illegible applications, so that is why we prefer this. Not only that, it gives our employers and our broker partners a dashboard so they can manage enrollment campaigns. You'll be able to see who has completed their application. You'll be able to see who started but not finished. And you'll also be able to see who hasn't begun, so you can give those employees a little extra nudge. Some timelines for the underwriting process. For new business, if you're looking to get an underwritten firm proposal, it'll be approximately 3 to 5 business days from the complete submission. For renewals, once we release the renewal to you, if you give us an additional application, it could take approximately 2 business days to get an answer on the revised renewal rates. And of course, missing or incomplete information will just extend those timelines. So yes, if you're submitting an application, please be sure to make sure that it's complete. For traditional self-funded, again, this is the groups that are 100 plus. RFPs take approximately 10 business days to receive a stop-loss quote. We ask that you try to give us as detailed claims information as possible. If we're getting not so detailed information, this time of year, stop-loss carriers are more likely to decline to quote your group. So yes, it's very important that we get as detailed information as possible. And if you do have some large claimants on the plan, we just ask that you give us a story. Is the member still actively being treated? If so, what is their prognosis? Or if they're terminated from the plan, let us know that too. Obviously, if there's high risk and they're terminated, that's a good selling point to a stop-loss carrier. And as always, our sales team are always eager to join you on the presentations directly to the clients. And a few reminders on some of the technology regarding self-funding. Some of them have already been touched on. Melissa already talked about Ease, that platform. It's not only for open enrollment, but it's also for underwriting of groups. So in addition to Ease, we also have FormFire. These are both platforms we have subscriptions to. So if you wanted to use our service, employees can go in, fill out their application online. We can submit directly to the stop-loss carriers. It's very streamlined and easy to use. Some of you may have attended the Poindexter demos that we had approximately 2 weeks ago. Poindexter is a powerful data analytics tool. We can do get a lot of great reports out of this. This helps with our renewals when negotiating renewals with our stop-loss carriers. It also puts a lot of reporting at the fingertips of the employer group and the broker. You can get customized reports that might otherwise take a day or two to get. These will be real time at your fingertips when you want them. And lastly, the health audit. This is basically what we're suggesting is that our broker partners can position both self-funding and fully insured. So if you wanted to lead with self-funding to see if that's the best fit for the employer group, you can lead with that. But if for some reason self-funding is maybe not the best fit, you can still pivot and present fully insured and earn the business that way. So you're covering all your bases. The goal is to help you guys get the business no matter what. All for me. So I'm going to hand it back to Joyce to talk about next steps.
All right. I'm going to do my best Joyce impression. Nope. Just kidding. Next steps, I'll do the best to wrap up here, Joyce. Collaborate with your broker rep team. We are here to help and support. Look out for invitations for the upcoming events. They're important. We want to kind of outline all those for upcoming events. Obviously, first, we have Medicare Advantage webinar. That's next week. So make sure you jump on that. That's going to be a huge opportunity in our market space. We have our quoting one in the end of September, which is our official quoting launch for the new quoting platform. And then we're doing Ease trainings also mid and end of September. So we can learn about the new online enrollment capabilities there. So look for those invites. Please feel free to reach out to our team. Feel free to reach out to any of us. Joyce's phone never gets stuck on mute. It's just her Zoom. So you can feel free to call her anytime. But feel free to reach out to your broker rep team. Our leadership's always available for our brokers, and that's something we take pride in. And then all of our distributions and email boxes that we referenced today, from case submission to individual business to large group to self-funding, all of our distributions are there for your convenience. So with that, This is Joyce Cardwell signing off. And thanks everybody for your time. We really appreciate you taking time out of your day to meet with us and hang out with us for a little bit and talk about fourth quarter. And we look forward to having a good one. We are going to post this recording up on YouTube, and we'll push that out as a copy for people as well. So if you want to listen to all of this again because you found us extraordinarily charming and helpful, feel free to check us out on YouTube, like and subscribe. All right, we're done, right? We're done? Sorry, this is supposed to be Joyce's slide. We're done. Thanks, everybody.